Tell us about your work with advancing the implementation of Obamacare.
Well, we've been working really hard in key states to get Medicaid expansion. We worked really hard to pass the Affordable Care Act, and I have the honor of having written the Nuns Letter that 59 Catholic sisters signed that President Obama told me was a tipping point for passage of the Affordable Care Act. But now what we're doing is, in key states, pushing to get governors to expand to cover those who are living in poverty, within 138% of poverty. It is wrong in the richest nation on earth that our people don't have access to health care. And so we're pushing to make a change. We have teams in 10 states who are working really hard to make a difference. So Pennsylvania, they've making progress. Ohio, they did great work. And then 8 others, they're still working hard.
I see healthcare as an essential human right. So, I mean, then you would support a single payer.
Oh, single payer makes the most sense long term. I mean, Medicare for all. The fact is we had a system that couldn't go from our very complex private market system to single payer in one step. And my hunch is that over the next few years, we'll move gradually in that direction. The exchanges in many ways are movement in that direction. I was disappointed we don't have a public option on the exchange to help keep contain
As
costs.
was I.
Of course. The House bill was way better than the Senate bill. But the Affordable Care Act is such a huge step forward. It's a significant change. It's the first step. But we're not done. We still have work to do.
I do think that progressives overlook the accomplishments of the Obamacare, of the actual act. I mean, it's a huge step forward to say that people with pre-existing conditions aren't, going to be denied coverage.
Let me tell you a story. I was just gave a talk at university. I was their winter commencement speaker, and afterwards, a woman came up, told me she was an adjunct professor, that she and her husband had not had health insurance for themselves and their 2 young kids. He's a small business owner. They didn't have enough money to buy health insurance. She didn't get it through her own job. So finally in December, they got online and they got health care. It was only going to cost them something like $280 a month because they're low-wage folks. But you know what happened then? He, just around Christmas, went to the emergency room and got diagnosed with cancer. And if they had not been able to get health care coverage, he wouldn't get treatment. And now, with no pre-existing condition, he can't be thrown off for having cancer. So this is hugely important for our people.
I was actually personally uncoverable prior to this. Like, I've been denied insurance on the basis of a pre-existing skin condition. So, and not like we can't cover you, with a rider. Like,
right. We won't just leave this piece out.
We won't cover you under any circumstance.
Period?
Yeah.
Oh my gosh.
So it's actually a huge step forward for me personally. So
congratulations.
I will say that I haven't been able to get access yet, though, to the coverage because of the website.
Yeah.
So.
Well, we have good news and bad news. We're getting there. We're getting there, though. But the amazing thing is even Google and Microsoft, they have glitches. So I don't know why we're surprised that a complex system that was to work in 35 states, run by the federal government, that they wouldn't have some problems going forward. People don't understand just how complex this is to determine your
But I think it's too complex. I mean, if you just had Medicare for all, don't you think that would have been much easier to institute?
It is, but then
just from like the, actual
it'd be easy to institute, but
implementation.
Then we'd have for people signing up, yes. However, the dislocation in terms of unemployment, then we'd have trouble because all of the private industry folks that are employed in insurance companies, the advertising companies, all of that, they would have been out of jobs. So as an employment transitional piece, yes, it'd be easier to sign up, but we'd have more trouble on the other end.
I do think, though, I mean, there's always an argument about putting people out of work, but we shouldn't be creating jobs that perpetuate faulty systems.
A bad system.
This is something that's detrimental to the fabric of American society. I mean, what it means to be an American to me is living the American dream means having health care coverage.
Yeah, I agree totally. But the other thing is sometimes us progressives, we spend too much energy on lamenting the not perfect. And the Affordable Care Act is such a huge step forward that we need to rejoice and celebrate it. I've got a pope right now, which is really nice, that's saying we've got to have joy. And joy in celebrating the step forward that the Affordable Care Act is important. We also have to say it's not the end of the story. We've got more work to do.
So do you think the Pope would support single payer?
I have no idea. It's a complex thing. What he'd say is everybody has a right to health care. Wow. Let's get everybody covered. Undercurrent, under the surface.